Okay, the question for sickle cell reads as follows. Kangwa Innocent, aged 23 years, is brought to your ward by his mother and a diagnosis of sickle cell in vaso-occlusive crisis has been made. Question A, define sickle cell. Question B, state 5 signs and symptoms that Kangwa will present with. Question C, explain 4 types of sickle cell crisis. Then question D, discuss the nursing care that you will provide to Kangwa within the first 24 hours of admission. And question E, outline 5 points you would include in your information, education, and communication to Kangwa and his mother. So when we talk of the question for sickle cell, that is the question we are dealing with today. So in terms of defining sickle cell, we can define sickle cell when we compare it to the general anemia. Sickle cell is a genetic disorder, whilst when we look at the general anemia, that one almost every one of us we are predisposed to it for as long as we are missing something or some nutrients in our body. Now, when we talk of the definition of sickle cell disease, keywords needs to come out. For example, the first one is that sickle cell is a severe condition. This is because for sickle cell, it only becomes a problem when the patient goes into a crisis. For as long as they are not in a crisis, they are okay. But the moment they go into a crisis, it is a severe condition in such a case that it is the matter of life and death. The patient may not survive. Apart from that, we are talking of chronic, meaning that this particular condition stays with the patient for as long as they live, because it's a chronic disorder, and this patient will continue having these crises every now and then, and the main aim is to avoid this patient from having frequent of this crisis. The other one is that in the definition we are saying that it is a hereditary hemolytic disorder. Hereditary meaning that we inherit it from both parents, meaning that for a child to have sickle cell, to present with sickle cell, they inherited both defective genes of hemoglobin S from both parents. But if only one parent is, for example, a carrier of sickle cell, the child will only inherit one particular S hemoglobin, and the child does not have sickle cell because they are only carrying one, meaning that the chances of them having a sickle cell child are what will determine the partner they will marry. But in this case, for sickle cell disease, for a child to have sickle cell, the inheritance is from both parents. I know most of the time the men will come out clean and say, no, we have never had this problem in our family and whatsoever. But for sickle cell, just remember that both parents you have contributed to the hemoglobin S. And in the definition, we're saying hemolytic disorder. This is because in sickle cell disease, the structure of the red blood cell is sickle-shaped because of the change in structure of the hemoglobin, because of the presence of hemoglobin S itself. So because it is sickle-shaped, the lifespan of the RBCs is reduced by the body, and this makes the body to break down red blood cells at a very faster pace. Hence we are talking of it as a hemolytic disorder, because the body breaks the RBCs, which are sickle shaped, at a very faster pace, almost on daily basis. Then apart from that, we are saying all this in the definition is just due to presence of homozygous, presence of hemoglobin S, meaning that when the child has 2 hemoglobin S on the shell of the red blood cell, this changes the structure, giving us all these characteristics we have talked about. And one of the characteristics we can see for a patient who has sickle cell is pallor. They usually look pale because the red blood cells in circulation are usually few. Hence, you find that almost all the time this individual will look very pale because the body tissues are receiving less blood and the oxygen. severe pain and crisis. Of course, one of the main characteristics we see in sickle cell is a crisis, and the crises are all characterized by severe pain. So no matter, we will talk about the different types of crises, but in all of them the patient will be in severe pain because of reduced oxygen supply to specific affected body tissues. So when we are defining sickle cell, these key terms need to come out in the definition, and of course that is how we can define sickle cell. Okay, so the next question is saying state 5 signs and symptoms that Kangwa will present with. So of course when a question says state, you need to mention the symptom, and you also add an explanation how that symptom comes about. So one of the symptoms that we see is the bone pain. So this patient will be feeling pain that is originating or coming from the bone tissue itself, and this is due to ischemia. Remember, the bone marrow, which is found in between each long bone, is the largest producer of red blood cells and also just other blood cells. And in sickle cell, it is these blood forming organs that are affected, and sometimes there may be over accumulation of sickled red blood cells in the bone marrow. Sometimes it may be lack of red blood cells in the bone marrow itself that may lead to severe pain. Apart from that, delayed growth and puberty because of reduced energy demand of the bone marrow for red blood cell production. So in sickle cell, the red blood cells are few which are viable, and then you need a lot of energy to produce everything that the body needs for growth to take place, from nutrients to minerals and all other things. And all this will require glucose, and it will require oxygen, and all these things are carried by the red blood cells. But in this person, they have red blood cells which cannot perform a normal function. So what the body does is that it delays growth so that the little red blood cells that are there can meet the body demand of a smaller body size. And this is the reason why, if you take note, or you see individuals who have sickle cell, they look very young, but when you ask their age, maybe they are in the early 30s or approaching 30s, but the body looks like it's a 16-year-old or 15-year-old person. It is just the natural way of the person's body to make sure that the little red blood cells that are there can meet the demand of a smaller body size. Fatigue as well, this is just due to tissue hypoxia. The oxygen carrying capacity of the red blood cells is low, hence we see fatigue. Fever, this is due to inflammatory reaction caused by tissue infection. Apart from that, jaundice may be seen due to increased levels of bilirubin as a result of increased hemolysis. Last week we looked at jaundice, and we said jaundice arises because of it arises because it is an end product of the broken down red blood cells. Hence we see bilirubin in the blood. So in this case, where the patient has sickle cell and the red blood cells are being broken down very faster, we'll see that the levels of bilirubin goes higher than what the liver can conjugate at a particular time. Pallor, this is just due to low hemoglobin levels affecting oxygen supply to the body tissues. Rapid heart rate, this occurs as a compensatory mechanism to hypoxia. When the tissues are receiving less oxygen and blood, the heart will have to start pumping very fast so that the little blood can meet the demand of all the body tissues, and the end result that we'll see is a rapid heart rate. Also, susceptibility to infection or increased infection, this is due to low immunity. One of the things we see in sickle cell is that the body concentrates on producing immature sickled red blood cells and forgets about producing other type of blood cells. Remember the blood components, we have plasma and we have white blood cells. So in this case, the body completely forgets about producing the other two blood components, and it has just focused on producing immature white blood cells. And this is why there is reduced immune system in someone with sickle cell, and this makes them have increased chances of suffering from an infection. So these are some of the symptoms that we can see in sickle cell. The next question is talking about explaining the 4 types of sickle cell crisis. And whenever a question for sickle cell comes, the question on sickle cell crisis does not miss. So it's always important that we need to know the types of sickle cell crisis. The first type of sickle cell crisis is what is referred to as hemolytic crisis. Now, when we talk about hemolytic crisis occurs due to presence of hemoglobin S, and this hemoglobin S is very fragile and it is easily broken down or hemolyzed. And this will result in severe breakdown of the red blood cells, causing low oxygen carrying capacity. And because there is low oxygen carrying capacity, this reduces the oxygen tension in the body, and this is what takes the patient into a crisis. So when we talk about knowing which type of crisis the patient has suffered from, most it's difficult to know when the patient is having the actual crisis. But when you do the investigations, that's when you realize that the patient went into hemolytic crisis, because when you do the HB, you'll find that the HB is very low and the red blood cells are being broken down very fast. So when we talk of hemolytic crisis, that is how it occurs. The next type of a crisis is what is known as thromboembolic crisis. And thromboembolic crisis is also known as vaso-occlusive crisis. So a thrombus is a clot, hence coming from the thromboembolic coming from the name of a clot. Okay, I don't know, are you able to see the slides?
Yes, sir.
Okay. Okay, thank you. Okay, so I was saying thromboembolic crisis, coming from the word itself. A thrombus means a clot. An emboli is a moving clot, but a thrombus is a stationed clot. So when we talk of thromboembolic crisis, meaning we are saying in this case, the patient has gone into a crisis because of blockage by the clot. Vaso-occlusive occlusion means blockage. So thromboembolic vaso-occlusive means one and the same type of a crisis. So when we talk of vaso-occlusive crisis, the first thing is that the hemoglobin S, because it changes the structure of the red blood cell, it tends to increase the viscosity of blood. Now, the question does not have the pathophysiology, but in the notes the pathophysiology is there, and I'll try to explain it so that as you read from the notes, it will make sense. But this particular point is saying that the presence of hemoglobin S, it changes the structure of the red blood cell and it increases viscosity. This is because one red blood cell has 4 hemoglobin. So this prevents one red blood cell from sticking to another red blood cell. And this also prevents one red blood cell from sticking to the walls of our blood vessels. But when the structure is changed, where there is hemoglobin S, the red blood cell have the ability to stick to each other when conditions changes. For example, when it becomes cold, when it becomes very hot, when the patient is dehydrated, the red blood cell will easily change the structure to become sickled, and when they become sickled, they easily stick to each other. So because red blood cells in sickle cell, they tend to stick to each other, they easily lead to blockage of the blood vessels by formation of thrombus. But these are blood clots that are forming because the red blood cells are sticking to each other because they have an abnormal structure. So when that happens, it means that that particular area or organ that is affected, there will be low oxygen supply to that particular area, causing a crisis. And in this case, the patient will complain of severe pain from affecting a specific body area. If it is the leg that is affected, this patient will complain of severe pain on that leg that is affected. Then you may easily suspect that the patient went into thromboembolic crisis. So basically that is about the second crisis, which is thromboembolic. The third type of a crisis is what is known as a spleen sequestration crisis. When we talk of spleen sequestration crisis, this is where there is large amount of blood which is trapped in the spleen, and this causes circulatory collapse in general circulation, which leads to low oxygen levels, and this causes a crisis. So again, the spleen in our body we have two main organs that produces red blood cells and other types of blood. We have the bone marrow as the major producer. Then we have the spleen, which is found on our right upper quadrant, which is the minor producer of red blood cells, but it also acts as a storage for red blood cells. So now, in the spleen, when blood is produced from the bone marrow cannot keep blood there once it produces. It releases it to the spleen for temporal storage until at a point where our body needs it. So the spleen may be trapped or blocked by the sickled red blood cells, because when they clump together and they form masses of blood, meaning that the outlet of the spleen will be blocked. And this is where we say the patient has a spleen sequestration crisis, because the blood that came from the bone marrow goes to the spleen, but the spleen is blocked and it is not releasing this blood in circulation. Hence, at the end of the day, you even see that the patient will have splenomegaly, enlarged or bulged spleen, because of its blockage. And the patient would have gone into spleen sequestration crisis because of that. So that is why we say it is very important to donate blood, because when you donate blood, it sensitizes the spleen and the bone marrow how fast to produce more red blood cells. And this is the reason why in an accident, a man is likely going to die as compared to a woman, because for a woman's body, it has always adapted on how it produces blood very faster because of the menstrual cycle. But for a man, because we don't usually donate blood or lose blood, it may take time for our body to produce in a situation that we are involved in an accident and we lose a lot of blood. It's because of this mechanism. So on spleen sequestration crisis, that is what happens. The last type of a crisis is what is known as aplastic crisis. On aplastic crisis, this is where the bone marrow is unable to produce enough red blood cells, and this will result in low oxygen tension due to inadequate red blood cells. And the end result is that this patient will go into a crisis. So when we talk about aplastic crisis, the body at this moment, it has realized that it is producing defective red blood cells. So it is the initiative of the body that because it is producing sickled red blood cells, probably it should stop producing. But now remember that the bone marrow is the largest producer of RBCs. The bone marrow can't meet the demand alone. So the bone marrow, once it stops producing, so that it sorts out the problem, but it ends up creating another problem, because there will be now low red blood cells in circulation and low oxygen being delivered to the body tissues. So the patient will go into a circulatory collapse, the entire system will collapse because there is low RBCs, and this takes them into a crisis where they will have severe pain, most generalized on the entire body because of reduced production of red blood cells from the spleen. So all these types of crises, it is not so easy to determine them when the patient is in a crisis, but when you do investigations, now you're able to tell which type of a crisis the patient went on based on what comes out positive. So that's about the types of crisis. Any question or clarification before we move on? Okay, so if it is clear, I said I'll just explain. Now, when you read through the pathophysiology, you find that the first thing we say in the pathophysiology of sickle cell is the normal structure of the red blood cell and the abnormal structure, and how the abnormal structure causes the characteristics that we see. So the first thing is that hemoglobin, when you do tests to check the structure of hemoglobin, the tests are supposed to give you what is known as HbA. HbA stands for adult hemoglobin, meaning that this person has normal hemoglobin, and HbA has, of course, it has 4 hemoglobins surrounding one red blood cell. So if this is the red blood cell, there will be 4 hemoglobins like that, another hemoglobin, and another one here. So presence of the 4 hemoglobins like this gives a red blood cell its normal structure that we see. And when a red blood cell has 4 hemoglobins, it prevents one red blood cell from sticking to another red blood cell or to the walls of the blood vessels. However, presence of hemoglobin S, so hemoglobin S is abbreviated as HbSS. It means, so on the test when you see HbSS, it means that this patient does not have adult hemoglobin, but has hemoglobin with the sickle cell proteins. So the hemoglobin S stands for sickle cell protein shells on the red blood cell and not the normal adult hemoglobin. So from the pathophysiology, when you read through, you find that it says that when an individual has presence of hemoglobin S, this will change the structure of the red blood cell, allowing it to contract and forming a sickled red blood cell. So that statement means that if, for example, one red blood cell has HbSS, meaning that now at this moment the structure of the red blood cell is going to change. Think of it, we are saying a red blood cell should have 4 hemoglobins, and these 4 hemoglobin without the HbSS, it means that they are having the same charge. Think of it as this is a positive charge, this is a positive charge, this is a positive charge, and the other one is a positive charge. And when we take these two charges, it says that things of the same charge, they repel each other. So this is what makes the red blood cell have this structure. But presence of hemoglobin S will change the structure of the red blood cell. Think of it as this area where there's hemoglobin S, instead of having a plus, it has a minus. It means that now the opposite hemoglobin with HbSS will be attracted, or it will twist to be attracted to the opposite hemoglobin. And the end result that you're going to end up having is a sickled red blood cell like that. And a sickled red blood cell will now have 2 viable hemoglobins. It will only have 2 viable hemoglobins, and the other one is not going to be viable. So the 2 that twist coming on the middle, the one that will mix together here, they are not viable. They don't perform a normal function. So when you read through the pathophysiology, it continues saying that presence of sickled now red blood cell will reduce the oxygen carrying capacity in the body, which means that the red blood cells are supposed to carry, normal red blood cells are supposed to carry 4 molecules of oxygen, but a sickled red blood cell can only carry 2 molecules of oxygen. This means that this person's body is only carrying half the amount of oxygen because of presence of sickled red blood cells. And apart from that, repeated sickling of red blood cells will cause obstruction of the blood vessels. So the same way the red blood cell twists and becomes sickled, a lot of red blood cells now will be attracted together, forming masses of red blood cells because they are sticking to each other. And as they form masses of red blood cell, the blood vessel become blocked. And once the red blood cell, the blood vessels become blocked, this will now affect oxygen and blood supply to the affected body tissues. Now, from the same pathophysiology, it goes on to say that repeated sickling of red blood cells, it will distort the structure of the red blood cell permanently. What that statement means when you read through the pathophysiology is that the red blood cell, when it becomes sickled like this, maybe because the conditions changed, it became too cold. When you remove the causative factor, maybe the coldness disappears. The red blood cell will usually return to its normal structure, which is this one. But again, when the patient is exposed to coldness, dehydration, infections, or any other risk, again the red blood cell goes back to being sickled shaped. However, when a patient is going into frequent crisis, the red blood cell will become sickled permanently. And when the red blood cell becomes sickled permanent, it means that the membrane of the red blood cell has been completely damaged and it can't go back to its normal state. So that is what that statement says, to say repeated sickling of red blood cell will cause permanent distortion of the cell membrane of the red blood cell. Now, when that happens, the red blood cell will become fragile and it is easily broken down by the body. And the body will now reduce the lifespan of all sickled red blood cells from the normal 120 days to less than 30 days. However, the reduction in the lifespan of the red blood cell will increase the viscosity of blood because of increased hemolysis. And this now causes the patient to go into severe anemia and frequent crises, pallor, fatigue, and generalized body pain. So that is what happens in sickle cell crisis. Because of the change in the structure of the red blood cell, the lifespan is reduced. Red blood cells are being broken down very faster. When red blood cells are being broken down very faster, means that the viscosity, which is the thickness of blood, goes up, because it's like you're adding sugar in water. The water becomes heavy. So the same way is happening to the red blood cells that are being broken down very faster. The blood is remaining heavier and heavier. It is remaining like porridge-like. So when that happens, it means that circulation to the body tissue becomes severely affected, and we end up seeing all these characteristics happening because of increase in breakdown of RBCs. So basically, that is the explanation of the pathophysiology that you may find there. This is because you may still be asked to write the pathophysiology. Sometimes the types of crisis may not be there, but you are asked to explain or describing the pathophysiology. So that is about the pathophysiology. Then we can go back to our usual question, and our next question was talking about nursing management. Now, when we talk about sickle cell, like I mentioned from the start, sickle cell is a genetic condition. Means that even up to now we don't have conclusive treatment for sickle cell, or we have mostly asymptomatic treatment. Sometimes these patients are put on intensive ferrous and folic acid or other blood supplements for the reason that they at least promote a lot of production of, even if they are sickled red blood cells, but if there are a lot of them, it reduces chances of going into a crisis. Some patients are of course put on some intensive blood transfusion procedures, but even if you transfuse normal blood, the problem is where the production is happening from. This person was born with genes that can only produce sickled RBCs, and they can't produce normal RBCs. So that is where the problem is. So even if you transfuse, you put in blood, that blood that you have transfused will not stay forever. It will only stay for a maximum of 120 days, then new blood needs to be produced. So that is why even up to now we don't have conclusive treatment for sickle cell. Of course, there are some trials like bone marrow transplant, entire bone marrow transplant. These are still trials being done, but we don't have medical treatment or conclusive surgical treatment. And of course, yes, I'm saying there's bone marrow transplant, but bone marrow transplant again is not conclusive. It only helps up to some point. The problem is genetic. Something that is genetic is difficult to control. Even if we get bone marrow from another person, then we push it into this person with sickle cell, the chances are that because of genetic makeup, the same bone marrow you have pushed into this particular person will also start producing sickled red blood cells, because the problem is coming from the blueprint, not from the product itself. So that is why even bone marrow transplant can only help someone live for just some years, but not as 100% conclusive treatment. But the only treatment that has so far seen to be worked is using genes of a lizard, because a lizard is able to reproduce. Even if you cut the tail will grow back. So they are trying to use cells of a lizard and try to see how to force the body to produce normal cells. And those are some trials that have seen to work almost effective. So I'm sure when they become successful, those will be used for a lot of other treatment, inclusive of cancers. So that is why most in the exam, the question may either say describe the nursing care plan, or discuss the nursing care or nursing management, but not medical management, because we don't have conclusive medical treatment or surgical treatment for sickle cell. So in terms of our nursing care, of course, you talk about to relieve pain, to resuscitate the patient, to promote comfort, and to prevent complications such as splenomegaly. Sickle cell is an emergency condition. Like I said in the introduction, sickle cell is not a problem for as long as the patient is not in a crisis. Sickle cell becomes a problem when the patient is in a crisis, and whenever the patient goes into a crisis, it is an emergency, and that is why we use the emergency outline. Of course, you talk about the airway, talk about the breathing, you talk about circulation, and from circulation you talk about pain management. So from the outline of the emergencies that we have looked at, the only difference is that after the ABCs in sickle cell, you add pain management. But in the other emergencies where there is no severe pain, we don't talk about this heading. Apart from that, then you continue from general eprophenema. You talk about environment, the usual point that we have been discussing on environment. You talk about rest, of course. You talk about observations. From observation, you talk about psychological care. And psychological care is important because you need to tell and advise this particular patient that they may have a challenging life. The patient, if this is a woman, they may have difficulties having a child, and just having their child will need to be closely monitored with a lot of supplements just to increase the chances of success. But even then, the chances of losing one of the two is high, or losing both during delivery is high. So psychological care needs to be given conclusively. Apart from that, if this is a man, they will have challenges having an erection. most of the time they will have a painful erection, because in a man an erection occurs because blood goes to the penis and the blood vessels block the blood for about 10 to 15 minutes. Then that is the period the man has that particular erection. Then after 10 to 15 minutes, the blood vessels open up so that before the tissue of the penis dies, the blood goes back to the heart, recirculates, and on average, another erection a man can have may take about 20 to 30 minutes from the first erection. So that is why for ladies, a normal sexual intercourse, according to science, should just go up to a maximum of between 10 to 15 minutes. Anything beyond that, there is mwana peruke involved. It's not normal, because physiologically it cannot be like that. And now you'll find that if this man continues using these syntocin traditional drugs or sexual enhancement drugs, because the penis is being blocked for a long period of time, it starts shrinking and it becomes very small. And that is why the challenge is, because the body was meant to recirculate the blood between 10 to 15 minutes. But in this patient with sickle cell, they have a painful erection which they can't use for sexual satisfaction. So psychological care, very important. Hygiene, also exercise. I've just heard about Mwana Peruke in the streets of Lusaka when I'm passing. I don't know what it is, but I need to find out how it works. So exercise, from exercise, talk about nutrition as well. And then from there, talk about, of course, medication, and of course, elimination. And on elimination, you are talking about the urine output, bowel opening, all those points. So I'll still share these slides in case someone missed the emergency outlines. But those of us who have attended all the other emergencies we have done, the only difference is on pain management, but the rest is the same. Now, in case you are asked for a nursing care plan, I've added possible nursing problems that you can use if you are asked about a nursing care plan. Like, one of the problem you can use is impaired tissue perfusion. This is related to sickling of red blood cells, evidenced by pallor. Severe pain related to increased viscosity of blood, evidenced by patients' verbalization of pain. The other nursing problem we can have is activity intolerance, and activity intolerance related to increased fatigue, evidenced by patients' exhaustion with minimal activities. Apart from that, knowledge deficit. Knowledge deficit is related to lack of knowledge on the disease process, evidenced by a patient asking too many questions. Risk for infection related to patients' lowered immune system. So these, in case you are using a nursing care plan, these are some of the problems that you can use in your nursing care plan. But if the scenario is specified that the patient has a sickle cell and they are unconscious, instead of you even using impaired tissue perfusion, you use the actual problem of difficulties in breathing, because you know that the patient is unconscious. But if they have not specified whether the patient is unconscious or not, impaired tissue perfusion is the best problem. But they have same interventions. The problem for difficulties in breathing and the problem for impaired tissue perfusion, they have similar or same interventions. Our last question was talking about IEC. In terms of IEC, one of the IEC you can give is importance of staying hydrated. This is because when the patient becomes dehydrated, this forces the RBCs to change the shape and become easily sickled, and this can lead into a crisis. Avoiding triggers as well. Triggers like cold temperature. When it is cold, the blood vessels of a sickle cell patient will become sickled, and this will easily take them into a crisis. High altitudes where there is low oxygen levels, this will easily take the patient into a crisis. Strenuous exercises, either physical exercises or even extreme sexual intercourse, also those they increase energy demand, and this will easily lead to sickling of the red blood cells. So even the exercise for sterile procedures has to be reduced for such a patient to avoid crisis. Dehydration, also emotional stress, all these are triggers that you can advise the patient to avoid so that they don't go into frequent crises. Infection prevention, you teach the importance of, for example, hand washing, vaccination to specific conditions like those from pneumococcal influenza or meningococcal, and you encourage them to seek early treatment so that they avoid such infections which can easily cause a crisis. You can give IEC in terms of pain management at home when the patient is in a crisis, and you can talk about using prescribed medication, warm compresses, rest, and also hydration. All this can at least reduce the intensity of pain. And of course, the last one you can talk of is medication, where you encourage the patient to take drugs daily, such as folic acid, ferrous sulfate, zinc, and antibiotics to prevent frequent crises. So in terms of IEC, these are some of the common points that you can give as IEC to the patient being discharged with sickle cell crisis. So that is all for today, unless